This video presents the theory and practice of motivational interviewing used in the Division of Cardiology. This is a guided, patient-centered approach using several tools such as an interactive wall chart to help patients follow their treatment and to become more aware of unhealthy habits in order to change them.
Good morning.
Good morning, I'm Richard. I've been called in for a coronary angiogram.
Good morning, I'm Elizabeth, your nurse.
And I'm Yvonne, the nurse's aide. Nice to meet you.
Nice to meet you.
We will meet and talk again in a moment, but now I'm going to have a look at your file. I will leave you with Yvonne so she can prepare you.
What do you know about angiograms?
Well, I had a heart attack a year ago, so I know that a catheter is used to take a kind of heart X-ray to see if the arteries need to be unclogged.
Right, I can see you know quite a lot about it.
Unfortunately, yes.
So, now I'm going to shave your groin area. Is there anything more you'd like to know about the procedure? Nurses' aides are trained in motivational conversation so that their approach to the patient matches that of the other medical staff.
Okay, now I've seen your file, but I'd like you to tell me in your own words why you are here.
Well, I had chest pains yesterday, and, I was worried because last year I had a heart attack with the same symptoms. And so I called my cardiologist, and here I am.
So you went to your cardiologist because you had chest pains that worried you. What do these pains signify to you?
Rephrasing what the patient says is an essential tool in motivational interviewing. It raises patient awareness of what he is saying and helps us ensure that we have correctly understood him and emphasized certain points he has made.
In our unit at the moment, we are working on cardiovascular risk factors. We have an interactive wall chart in the waiting room with 7 mural panels representing 7 cardiovascular risk factors. This helps us to clarify with the patient his own particular risk factors. Can we take 20 minutes this afternoon to talk about this?
Of course.
Asking the patient's consent is another essential principle. A motivational interview must always respect the patient's autonomy and personal choice.
Of course, we cannot modify age, sex or genetic factors, but there are 7 other factors that we can work on. These are cholesterol and blood sugar levels, physical activity, smoking, stress, high blood pressure and weight. Now I would like you to use these bars to slide the hearts to where you think your risk level is. The higher you place them, the higher the risk. The lower you place them, the lower you estimate your risk to be.
The initial aim of this activity is to help the patient evaluate his own risk factors and realize that his illness is not inevitable and that he can change his behavior to diminish the risk of further attacks.
I see you've placed stress as the highest risk, with obesity, smoking, sedentary lifestyle and blood pressure in the middle. If you could choose just one of these cardiovascular risk factors to work on, which one would it be?
The patient is asked to choose just one behavior to change. Having a single goal and knowing that this change will affect all the other risk factors keeps him from getting discouraged. He alone chooses which factor to work on. The nurse then congratulates him on his choice so as to encourage him and enhance his motivation to change. She emphasizes the positive aspects of change and asks what more the patient needs to know about the chosen risk factor.
Do you think that more information on high blood pressure and the treatment effects would help you understand the condition better and to follow the treatment?
Yes, I think it would certainly be a good start.
Well, first of all, I suggest that you read this flyer, which is a summary of this panel. Then, this afternoon, we will take some time to discuss things further.
The nurse makes an entry in the patient's file of the key elements that emerged from the motivational interview that has just taken place, especially the risk factor the patient has personally chosen to work on. The principle is that all the healthcare providers and services interacting with the patient, his physician, physiotherapist or others, should be aware of any particularly sensitive points involved, in order to work along the same lines to help the patient achieve his goal. At the same time, the nurse prepares a note for the treating physician to be forwarded to the head physician of the service where the patient is hospitalized. The original note is given to the patient as a kind of contract, summarizing the points on which he has engaged himself to act.
So the patient, Mr. Richard, born in 1958, had a radial approach coronary angiogram this morning with the placing of a stent in the circumflex artery. I did a motivational interview with him in front of the wall chart that went well. He is aware of his risk factors, mainly obesity, smoking, stress and high blood pressure. He has chosen to work on his blood pressure, which he considers to be the easiest for him at the moment. Yes, it's interesting in this situation that the patient is clearly asking for more information to help him follow his treatment better. There are other situations where we'd like to give information, but since we have to stay in the motivational context, well, there are things we have to respect in motivational interviewing.
We know that we can give information during a motivational interview, but only if we are certain in advance that the patient wants it. Individual and group healthcare providers work regularly with a clinical nurse specialized in motivational interview training to maintain and improve competence in motivational interviewing techniques. With this in mind, it is essential that health professionals exchange points of view, which leads to renewed motivation. The role of the unit head nurse is fundamental. She is the one who must stimulate her team to practice motivational interviewing and see that it is regularly done. The motivational interviewing technique can be used in various kinds of medical services. At the Geneva University hospitals, for instance, it is used in the neurology department as well as in cardiology, from the coronary care unit all the way through to cardiac rehabilitation, and notably in the context of the ELLIPSE program, where it is used in addition to other information tools.
Since I've been here, well, since the incident, I have been thinking quite a lot, so it is hard to say exactly how the wall chart influenced me. But I have been doing a lot of thinking just the same. We are not going to be able to fix everything in one go. We cannot fix all the problems in one go, but then we don't have to work on everything at once. And so, well, that's how I felt.
The interview was good. She explained things well, and we could talk. The wall chart taught me a lot, especially using those magnets that showed me where I was and what I could do to improve my quality of life. We could say life, but rather say health, yes. The wall chart helped me to see who I was, because it's true that up to now I've not looked after myself. I needed this little accident and the chart to become aware of the risks I was taking and how to do better.
Well, I cheated a bit concerning the interview with the nurse because I had already come and looked over the wall chart, so I was expecting the questions she was going to ask about certain things. I took the interview as an opportunity to share. I didn't feel that the nurse was going to give me a lesson or anything like that. It was really good. She explained things to me, and I think that that was very useful.